It's a topic that frankly isn't talked about enough, even though every single woman will go through menopause.
Oh yeah, and I believe I'm in perimenopause. So to break it down for us and help us to destigmatize it, we have our 9 News medical expert, Dr. Payal Kohli. Dr. Kohli, thank you for talking to us about menopause. So I often kind of text you, hit you up, because I have symptoms, I believe. So what are the symptoms? How do we know that we're entering menopause, perimenopause, all of it?
You know, ladies, we can't talk enough about menopause because it's the biggest transition in our entire life. One of the biggest things that's ever going to happen to us, and for many of us, like you said, Sam, we don't even know when it's happening. So age is the biggest sort of marker. So between the age of 45 and 55 is when most women will go through menopause. The average age is about 51, but some of us could go a little bit early, and there's many different factors that go into that. Our body will give us clues and symptoms when we're going into menopause. So listening to your body, looking for those clues, the most common clue being irregular periods. You're either having a lot, very close together, they're really heavy, you're skipping a lot. Now it's important to make sure you're not pregnant if that's happening, because in your 40s you can still obviously get pregnant. Even during perimenopause you can get pregnant. But if that's not the case, and you might be experiencing other symptoms such as vaginal dryness, hot flashes,
Irritability,
mood swings. I'm sure your husband will attest to that as well.
Yes.
Yeah, and
Yes.
weight gain and hair loss and skin changes. These are all symptoms that our body gives us a clue. If we think we're in perimenopause, we talk to our doctor, they can check a blood test. If it's elevated only once, it might not mean anything, but if it's persistently elevated, it's called the FSH test. That means you're in menopause. You've skipped a period for a year. That's menopause.
Whoa.
But what about hormone replacement? Because it feels like there's so many forms now. There's pills, there's creams, like how?
Some are natural, some aren't.
This is a really, really scary thing that people are thinking, oh, well, if I go into menopause, I want to still look younger and have my hair, and so let me just go on hormones, right? And it's a medical treatment that has a lot of risks. So when I decide when I'm putting a woman on hormone replacement therapy, I say the who, the why, and the when. So who? Is it a woman who has chronic medical problems, like she's had breast cancer or heart disease? That's an absolute no-no, because that woman would actually have an increased risk of blood clots and strokes and cancer if I put her on hormones. And then the when. Is it somebody who had premature menopause, meaning they stopped earlier than they should have, average age being 51? Then yes.
Do I have premature menopause?
I'll have to check
I
your
feel
blood
like
test.
I am.
I'll have to.
But then again, perimenopause, what's the difference between perimenopause and premature menopause?
So peri means you're doing this,
Okay.
getting ready for menopause. Premature means you've
Okay,
stopped,
so
the
I'm doing
ovaries
this.
have shut
But
down.
how long can that last?
Yeah.
How long can you be in this flux
I'm like
of
an EKG, up and down, up and down.
Years. Years.
Okay.
Yeah.
Lovely.
So
Thank you.
menopause for
Yeah.
every woman looks different. For some women, they will quickly transition from peri to full blown. For some women, they'll be in peri for a long time. It really depends on a lot of different factors, but it can last a really long time. But if you're thinking about going on hormones, make sure you do it short term. Make sure you don't have chronic health problems, and talk to your doctor before you go to some osteopathic clinic and get whether it's estrogen or testosterone pellets, because these can have real risks.
Yeah. Well, thank you for having this conversation with us, because I feel like we destigmatize it amongst ourselves, and we can start having this conversation with men, right? And like
They need to
bring
be
them
aware.
into the conversation.
Yes.
100%.
Yes, they
It
don't.
happens to us, it happens to our families.
Thank you.
Okay.
Thank you, Alex. Yeah,
Well,
you
and
heard
it's
that,
not
Mark?
It's not just about the physical change and the emotional change, but it's about our risk factors. After menopause, we got a target sign on us, so we need to make sure we're on top of our preventive screenings, we're keeping up on that weight gain, and we're staying active and healthy.
Thank you so much, Dr. Kohli, for all your insight. Kathy, what's coming up in weather?